to many people. It can mean something as little as just lightening your smile all the way to having to do a lot of dentistry to achieve that same smile. So, for example, if you were wanting to just lighten your teeth, you know, a lot of patients go over the counter and try to find things that will work, and they might get some success with that. But a lot of things that dental offices can offer is custom trays or different type of bleaching techniques that can lighten the teeth in a more uniform way, in a more effective way. And those things can range anywhere from a few $100s to, you know, say, you know, $300 to $600 sometimes, depending on the system that you're using and how many applications are needed as well. As far as other types of cosmetic dentistry that are available, a lot of people, you hear the words veneers, you hear the words, you know, cosmetic rehab or rehabilitation, or you hear new smile design. All of those things, then when you start getting to the point where we have maybe some changes that we need to make, that type of dentistry can range anywhere from simply 1 or 2 teeth with some bonding. That could be as little as, you know, $500 to $1,000 with some bonding. It could mean for just a few teeth, as much as to, on the other end of the spectrum, maybe the reason that you're needing you don't like your smile is because you have really some inherent problems, some instability in your bite, or in, you know, trauma or whatever has happened, maybe some bone loss due to periodontal disease, so your teeth don't look the way they used to. Sometimes we have to kind of pull in a lot of different varieties of treatment that might involve calling in a specialist to move some teeth, like braces with the orthodontist, and then we do some cosmetic work over that, maybe some veneers, but we have to get the teeth back to the right place first. So those things, you know, like I said, something as simple as some bleaching that could be, you know, $300 to $600. There are cases that we do that could be $20,000, $25,000 to get that smile that you really want. And a lot of people invest in that because that's important to them. So for patients that want to make those bigger investments, one of the first things that would come to my mind if I was searching that for myself would be, how am I going to pay for this? You know, is insurance going to cover some of that? You know, is there a way I'm going to be able to make payments? Because how would I come up with $20,000 just to do that? And so we have a lot of patients in that same boat. So we provided a number of ways to make that happen. One way is by doing care credit, which is a way of financing that. There's other options that basically you can have that same dentistry done, but in a monthly installments at whatever, you know, however long out you want to go. Also, there's some local banks that we work with that will help patients get, you know, small loans to be able to cover some of these costs. Sometimes our need goes beyond what their insurance will cover, even just because of disease, and so patients take advantage of that. Now, when you start talking cosmetic dentistry, insurance kind of gets a little tricky, because there are some things, if the tooth is broken down and it really needs to have a crown done for purposes of disease control or protecting that tooth, quite often insurance will cover that. But one of the big red flags for insurance companies will be, okay, if we have this whole mouth of you know, teeth that are all going in together, oh, red flag, that's cosmetic. So what we try to tell our patients is, sometimes we can get some assistance from your insurance, but the majority of things that we do with cosmetic dentistry is not a covered thing. So if we get some coverage, then fantastic, but plan on it not being something that's covered, is kind of how we inform our patients, so that they're prepared for worst case scenarios if they want to make a decision to do something to enhance their smile. There's a lot of things that we can do very simply and very much more involved, that we can get that smile that people want.